following are a number of examples of using point-of-care learning in actual clinical scenarios. Our first question involves, how often should a hemoglobin A1C be checked in a diabetic patient? We can use the Colorado Guideline website to help answer that question. By navigating through this website, we can find diabetic guidelines and then specifically adult guidelines to use in a clinical setting. From this guideline, we can look up specifically how often a hemoglobin A1C should be checked in a diabetic patient. In our next example, we ask, what is the appropriate management of hypertensive crisis? We will use the website eMedicine to answer the question. We type hypertensive crisis in the search window, and from there we have a number of choices reflecting clinical scenarios for the management of hypertensive crisis. Question 3. What are the appropriate malaria prophylaxis for travel to Afghanistan? Here we use the CDC website to obtain the answer. Again, navigating through this website, we can go to Travel Medicine and then select the appropriate vaccinations and or prophylaxis. Example 4. What are the potential side effects of metoprolol? To answer this question, we will use Epocrates Online. Our final clinical example asks, what is the creatinine clearance for an 84-year-old female who weighs 95 pounds and has a creatinine of 1.3? Here we use the medcalc.com internet resource to answer the question. We enter the clinical data and we are able to calculate the estimated GFR. To find a listing of point-of-care learning resources, we can go to the memorialcme.com website. Under the point-of-care menu on the left side, we are provided a list of resources for point-of-care learning. These resources are listed under general categories to help assist the user in identifying the appropriate resource.